Hi everybody. This is Q&A Friday. Sorry, I was distracted for a minute here. So I have some questions. We're doing this Q&A Fridays because there's a lot of questions that you guys have. I'm making sure my mic is good. And it's becoming a little bit more impossible for me to kind of attend to these questions. So I have Chris McCarran as well as Leslie Lipsius. They're going to be adminning this group to make sure that you guys get your questions answered. So it's good that you guys are all chiming in. I think you guys are all so lovely, but there's no way I can keep up. So we've selected some questions, and if you can keep a Q&A log, we're going to pin it to the top post after we do the Q&A. It's going to be, we're going to accumulate the questions in the tagged post or pinned post, and then every Friday I'm going to come in, do a live Facebook video like this, and then we're going to do the Q&A Fridays. Okay, so here we go. Number one by Janice Logan. The question was, anybody else having problems getting disability as a lupus? I already got denied once, need help, about to give up. Well, so I've done some medical questionnaires for a patient who had rheumatoid arthritis and lupus in the past, who were trying to get it. And it's an extensive process. Oftentimes in that, there is a designated attorney involved. And so most of my patients that were able to get it approved had attorneys, and I'm sure you can find it in your area, but you need documentation from your medical doctors to substantiate the fact that you can no longer work. So you're going to have a lot of medical records to gather and have your physician fill out some forms for you, as well as any other providers like physical therapists or anybody who are medically licensed to give you some, I guess, documentation so that you can use that for your court hearing. Okay, that's all I've got for you. I don't know the nuances of it. Second question by Cece Williams. Hi, Cece. Anyway, she's asked, and I've answered this in her feed, but she asked, has anyone ever had shortness of breath? And so I want to just say that shortness of breath is rather common, and I have it at times, is why I wanted to answer this. And it's sometimes worse for other days than normal. I have it usually when the weather gets a little bit fluctuant, when it's like cloudy and windy or storms about to pass through. Due to the barometric pressure changes, it does kind of hyper trigger my receptors, pain receptors that is. I don't know if there's a rhyme or reason behind it, but I do get really short, out of breath at times, and that's because our body's busy fighting the inflammation within. So oftentimes it sort of manifests this way. Sometimes high blood pressure, heart palpitations. I know you guys have been asking or commenting about that as well. These are all part of the same, I guess, category. Okay, so that's that. Next question is by Elise Bryant. Does anyone wake up or have stiff bones during the day? Well, this is very common for this to happen. While inflammation is somewhat elusive, we know that there are cytokines. There are inflammatory cytokines that's floating in our body, and they're chemical messengers that signal to the body, all over our body, to kind of send a signal back to our brain to receive that pain signal, right? And these are all chemically modulated. And it's a concept that is very, very hard to grasp at times. But after we wake up stiff, because at night we've sort of hopefully rested, but most of us some days don't get enough rest, and then cytokines build. And then when you get up to move, that's when it's like at all-time high and you feel stiff and achy, and you kind of know, oh my goodness, you're going to have sort of a bad day. But most of the time, you'll notice as you get up and moving, your symptoms kind of subside, right? And that's because metabolically, as you move, you're able to pump some of the cytokines out, filtering it through your heart, and metabolically taking all the toxins or cytokine metabolites out of your body. And so it's best to like move, even though it is not the most it is not the most obvious thing to do, because the most obvious thing to do is not to move, right? But despite how you feel, if you can kind of chug through and do gentle yoga poses that I've been posting in this feed or in this group, it's a very good thing for you to like keep moving, to kind of keep the joints kind of mobile and get all those toxins to flush out. And then before you know it, you'll kind of feel better. Okay, so I hope that that helps. The third thing is by Peggy Smith. Just wondering if anyone wakes up and your back hurts so bad when you go to the restroom, your urine is pinkish. And how do I know that it's my liver? How do I know that my liver is not doing well? Well, I've seen many lupus or autoimmune patients struggle with various types of infections. Sometimes they can be chronic and sometimes they can be short-lived. If you have a pinkish urine, sometimes it can be the onset of your menstrual cycle. So make sure it's not just, the tinged, usually that's more apparent when you're wiping. And if you're wiping a little bit of a tinged redness, then that's more an indicator that it's coming out from your vaginal canal. But if you look to the toilet and it's tinged red, I would be a little bit concerned, because that means you've got some blood in the urine. I wouldn't suspect the liver so much as I would first suspect my kidneys. Hematuria, which is blood in the urine, that's also a protein in the urine. That's indicative of something. So please go ahead and get that checked by your doctor, because we can play guessing games all day long, but we want to make sure that you stay safe. So run that by your doctor. It can be a primary physician or a rheumatologist, whichever one. And then make sure you get your urinalysis. That would be the first step. And please keep us posted on your status, Peggy, okay? Next question is by Julia Ponder. What can an ER do for lupus flare? Every inch of me is in horrible pain and I can barely move and I have terrible headache and blurred vision. Well, blurred vision is a little bit concerning, so that might be something warranting a ER visit sometimes. But for pain, there's not going to be much that they can do. They'll run the necessary tests to see. But if you've got good insurance, that's a good place to go. But if you don't have, you have a high deductible from going to the ER doctor, because they're just going to give you a lot of pain medications anyway, and then ask you to follow up with your doctor. Okay. So next question is by Yesenia Alvarado. Hi, Yesenia. She says, I was diagnosed with lupus and RA 1 year ago. My skin feels so tender all over, like it's bruised. All my joints hurt and limbs feel tingly. I don't have a good grip and I do pretty much everything. I drop pretty much everything. My stomach and scalp itch, although I have no visible rash. My face is peeling because it's so dry. Are these symptoms of RA, lupus, or both? Could it be fibromyalgia? Well, Yesenia, unfortunately, it can be the effect of all the autoimmune conditions that you mentioned. The itching, the weakness, and the tingling, and the peeling. These are all symptoms of a broken immune system. We've got some hyperreactivities. You can probably kind of check to see if you have histamine intolerance. We've all got sort of an overreactive autoimmune condition, so anything mysterious like that can be any one of those things. Fibromyalgia can cause it, lupus certainly can do it, and RA can do it. So it's probably the collective effect of all those things. That's my best answer for you. I know that doesn't help very much, but it does subside, so I would work on healing your gut to make sure that you keep or you build up the tolerance to such toxic exposure so your body doesn't react so badly, and take a probiotic. Because oftentimes the skin manifestations and all these autoimmune symptoms are a result of sensitivity to some toxic exposure. And the best way the toxins enter our body is through the mucosal lining in our gut. That's why I talk so much about the leaky gut. And that can be built up by taking some good quality probiotics, following through with an elimination diet to see if you can diagnose yourself, to see what you're sensitive to as far as the food's concerned. So I find that the elimination diet, also under files in our group, can help you to kind of get to the root of what foods you're sensitive to. And that would be a very good diagnostic tool as well as a treatment tool. So I hope that that helps. Next question is, what alternatives to the flu shot? I can't talk. What alternatives to the flu shot work with the persons that have autoimmune disease like lupus? Okay, 19 years of living with lupus, I've always been told initially that I must get a flu shot because I'm compromised, immune compromised, that is, right? So I used to go for years, just go for a flu shot because that's what the doctor said. And you know that I've always been a good patient. I was very compliant early on in my lupus until I realized it's really not helping me long term. So then I read up on the research and I opted to go without the flu shot because oftentimes it can trigger something else, right? And so my whole regimen in building my gut so that I have enough tolerance immunologically is a better way for me to kind of fend off the flu bugs. And I usually don't get sick. I have patients and I see patients all day long and they're usually sick and I don't get sick. And that's because I have a very robust immune system because I support it. So during the colder months, it's a good idea to supplement yourself with some vitamin C, zinc, and selenium. They've got this dose, it's called Airborne. It's an easy tablet that you can buy at any pharmacy over the counter. And during the flu months, when I have patients coming in and I know I'm going to be exposed to it or I'm going to be traveling, then I will go ahead and take that as a prophylactic thing to make sure I prevent any kind of flu coming on. And I do the same thing for my kids. My kids don't get flu shots either, and they do just fine. Washing hands and doing things like that to make sure that you kind of keep yourself safe are all commonsensical things that you can do. So I'm anti-flu shots, but that's just me. So next question is from Tamala Owens. What medications work best for pain? Well, I don't take meds. I don't take meds particularly for pain. If I have a headache here and there, I may take Advil if I have a full day ahead just to kind of get through the day, but that's very rare. Pain is due to increased inflammation. So I recommend you might take a temporary pain pill here and there, but if it comes to a point where you have to take it and rely on it every day, you're going to have a tolerance to it. You're going to have higher and higher dosage and you get addicted to it. Not to mention that you're getting yourself into a situation where you weaken your immune system by destroying and degrading your gut lining as well. So I have this pain control or pain support bundle for lupus on my lupuspharmacy.com to kind of decrease the inflammatory pathways in our bodies. And if you take this bundle, it works long-term to heal your inflammatory reactions in your body, utilizing the same pathways that the medications do, like the anti-inflammatories that you take, like ibuprofen. It works in the COX-2 pathway to decrease the inflammation. So I found that that's helped a ton in my dealing with my pain. So I'm in a good place, and I've gotten my patients there as well if you're interested in taking a more of a holistic approach. So we'll include that in the notes as well, or in the feed in this blog, in this post. Next question is by Ray Johnson. How do you change your diet without feeling deprived? I've been trying, but have been catching headaches and feelings of depravity. Please help. Well, first thing is to change the perception around the food, right? So anytime you think diet, it's highly restrictive, and most of us have a resistance to any type of health promoting thing. First thing that I want to put on the table is that let's be honest with ourselves. Food is highly intimate. It's a very personal thing, and food equates to a lot of emotions that we attribute to it. Food is very healing. It's very nurturing. It's very nostalgic, and it's very satisfying. And so a lot of you have, whenever you don't feel good, you crave certain things that your mom used to make, right? So I always tell my patients, when you look at the diet programs, you should look at it in a way that you change the way you look at food, right? if you change the perception of food as being medicine and healing, and kind of change your relationship with food, right? Because oftentimes what we do is, I have a lot of patients when they don't feel good, they kind of grab for the highly sugar-ridden things like chocolate bars or any kind of chips. You know, when they're stressed, they eat, and they just kind of go all out into a very negative diet pattern. But recognizing those triggers is key. But I want to say that I have my food vices, and I don't follow the diet 100%. I leave myself always room, but I can say that most of the time I do the right thing so that I can use food as a pleasure. And so I have desserts from time to time. I may not do, carrot cakes and chocolate cakes every day, but I can kind of do little bits at a time, and I don't feel deprived at all. So the elimination diet, also under file, is going to help you to kind of clean your diet out, to know what you're sensitive to, so that you can build enough immunological tolerance so that you can enjoy the food again, right? The whole key to this is not to be deprived. Please understand that food is something that we should enjoy, and we should really be happy with eating, right? It's not to take the joy away from the eating process, but to kind of be able to enjoy it once again. So this whole idea of temporarily engaging in an elimination diet, which is going to be healing for your gut so that you can build endurance enough to enjoy food again, is a whole concept to this thing. So if you feel really bad and if you want to feel really good again, it's a best way. It's the gold standard, and I promise you're going to feel so good after the elimination diet. Play with it a little bit, and be able to enjoy food again. So don't feel like it's deprivation. It's changing that mindset to say, okay, I'm going to try this out to feel better, and so that I can enjoy my food again. And then the key thing is to know what foods you can enjoy and what foods you can't. It's like the more you know, the better you're in control. It's amazing how freeing that is. So sometimes take the blind faith in knowing that, I've done the research for you. So just follow through and ask me questions like this to get you over the hurdle, because your mind is going to create a lot of obstacles, right? So anyway, so I hope that that's not a long, windy answer to a simple question, but this is one good question that most people struggle with. So anyway, thanks, Ray, for asking that question. I hope that helped. Next thing is Annie Colon. She asks, Dear Connie, my question concerns diet. I have noticed a positive impact on an anti-inflammatory diet can make. However, I have had a tough time maintaining it. Any tips on staying consistent with healthy eating? Thank you. So anytime you kind of go down the eating healthy plan, we always almost think that once you slip and fall, we hit a roadblock, that everything's just kind of goes south. And most of my patients just kind of stop dead in their tracks and they stop the diet altogether. That's not the way it works, right? So we have to almost expect these roadblocks. We have to expect that we're going to run into situations where we're going to be tempted and our will is done away with, and we're going to indulge in something that we shouldn't. And so even after that happens, knowing how to get back on track. So I use the Pareto principle a lot. It's 80% of the efforts comes from the 20% of what you put into it, right? So, I work smart, not hard, and I don't really eat a very clean diet all the time, but most of the time I do, so that I can kind of slip and fall and enjoy what I can. And so I'm very strategic about it. So very smart about what I can and what I don't. And if you spend time with me, you'd be very surprised to know some of the things that I eat and get away with without feeling bad at all, because I do all the other things right. So focusing on doing the right things, but not expecting perfect behavior all the time out of you is key. You will fall, but leave yourself enough cushion and have grace enough to fail at times and fall, but know enough to get back right on track is key, right? It's like it's like our faith, you know, it's our walk in faith. So it's a narrow path. So don't feel like you have to walk that narrow path, because our mind will play all kinds of games to go out of that path. It's key in knowing we walk close to that path enough to know that we stay close to what our pattern should be, as opposed to, you know, slipping and falling and then never knowing how to come back. Does that make sense? I'll try to be a little bit more elaborate next time. I hope that helps. This next question comes from Elise Bryant. Does anyone else get sharp pains in their boobies? So yes, I do get that from time to time, and you'll get that as well as the hormones fluctuate. So there's no rhyme or reason. Sometimes we have our receptors into our boobies, and that's just our nerve fiber. Sometimes it can be because of the inflammation from the lupus. Sometimes it can be just no rhyme or reason at all, or sometimes it can be a premenstrual thing. So there's really no specific answer to that question, other than yes, it's pretty common. So all these things are great questions, guys. I'm going to try to do a better job of presenting this to you. I know it was kind of all over the place, but keep asking away in this feed so that I can get back. And any technical questions that you come into or you have questions about, feel free to keep asking. Chris is going to put up another post every Mondays to kind of collect all the questions that I'll be answering on Fridays, probably at 12 o'clock. That's the plan right now. So until next week, I hope you guys have a great weekend. Bye.